Baptist Health System and BMC in particular have had a long-standing relationship with STRAC. Many of us have long-standing relationships with the leaders and the members of STRAC from prior work history, and so really have grown with STRAC, Baptist Health System, through the transition with Vanguard to Tenet, and with STRAC increasing their organization really and their support for all the healthcare systems in the community have really grown together over the last 10 years. So it was an easy fit. When presented with hurricanes in the past, all healthcare systems work really well with any state disasters or community disasters. So it was an easy roll into how were we going to organize and coordinate delivery of care and preparedness and anything we really needed to do in response to the pandemic. And it really started there with the initial presentation of cohorts from Wuhan, American citizens needing to come back to the States, and a cohort from the Princess Cruise Line that were housed at Lackland Air Force Base. So we initially got really involved about mid-February, and the relationship with STRAC allowed for all healthcare systems to sit at the table and really kind of develop an organized plan. How are we going to provide care for those cohorts from the start? So it allowed us to have one represented hospital per system, which helped tremendously. So we could concentrate our resources around PPE and the early isolation precautions and preparedness to receive an EMS patient from one of those cohorts off of Lackland. Which was tremendous. And then that laid the groundwork for our coordination going forward. We had a pod of about 8 representatives that I represented at Baptist Health System. We called themselves the Med Leads. And we really were the first small pod that would address an issue or a concern coming up, such as, when did we go to universal masking? That really started in the Med Lead conversation, and then it grew until we all said, this is what we need to do, and let's do it in a coordinated fashion so the community sees us representing these precautions and instituting these treatments and interventions as a community rather than one healthcare system doing something and another healthcare system not being aware. That type of communication and coordination was vital for how we were able to manage the pandemic as best we could, and I think we did a good job. That led into our ability to manage EMS calls so that one hospital or one healthcare system wasn't overly inundated and feeling more pressure than another. All healthcare systems through this developed even a stronger relationship than we had before with STRAC, being the I'm trying to think of the word.
This will be edited by us.
Yeah.
So don't worry about it.
Being the conduit for the atmosphere that we had, to where we did sit at the table at the same time, and
Did you say
and
that
really,
again? Because my finger got in the way. That's
yeah.
my fault. Sorry.
STRAC really served as the conduit for all of us to come to the table and share our concerns for how we were going to individually take care of this and how we were going to collectively take care of this for the Bexar County. And then once we really had that down, it really helped us in addressing the rural communities and addressing how are we transferring in, how are we sharing resources. We even got to the point here where we're sharing remdesivir to the rural communities. I mean, that level. And that was all coordinated so that every healthcare system knew what each one was doing in addressing this pandemic. So there was no gamemanship, there was no advantage to having staff being incentivized in a certain way and the other healthcare system not knowing. We really went into it as a team, and the foundation of that type of teamwork really comes out of us doing other projects even before the pandemic and just normal day-to-day operations on how we interact through STRAC being that conduit for bringing all the healthcare systems to the table, whether it be stroke care, STEMI care, sepsis, and all those coordinated ER practices. We had well-established communication. This just was a great example of how that early work and all the healthcare systems working together benefited us in a stressed pandemic. We shared equipment. We made sure that no one was feeling an undue burden that the other systems weren't. And it was a rewarding experience, although very stressful, and obviously very dangerous situation.